Good afternoon. My name is Althea Dumas. I am a student at Regis College in the College of Nursing in the Family Nurse Practitioner Program. I am here today doing my assessment for head, eyes, ears, nose, and throat. I have a volunteer for me. And before we begin, what would you like to be called?
My name is Miss Gwen Elise Washington, and you can call me Miss Washington.
Okay, Miss Washington, for the sole purpose of the video, I'll call you Miss W. Is that okay?
That's fine.
Do I have your permission to record you for the sole purpose of recording for my head, eyes, ear, nose, and throat
Yes, you do.
video exam? Thank you so much for your permission. And before we start, I already washed my hands. Me and Miss Washington are both going to use some of the hand sanitizer to clean our hands again. Thank you, Miss W.
Thank you very much.
And before we begin, do you have any questions?
No.
Okay. I will be HIPAA compliant. This information will only be shared when my professor is going to evaluate my ability to do this, okay?
Okay.
So as we start the head, eyes, ears, nose, and throat exam, do you have any questions?
It's not going to hurt you, will it?
No, it won't hurt. There will be no pain.
Okay, thank you.
You're more than welcome, okay? So as we start the exam, the first thing we're going to do is start with your head, okay? We start with inspection always. Inspection means to look with my visual eyes to check the size of your head, the shape of your head. And after I do a visual inspection, we do hands-on touch, which is palpation, okay? So I'm looking at your head, looking for the shape, the size, symmetry, looking at your eyebrows, looking at your eyes, looking at your nose and skin and your mouth. And now I'm going to touch, okay? Is it okay?
Yes.
Okay. So when I'm touching, and I'm trying to stay within the camera, touching the size, the shape, feeling for the shape of your head, looking for any lumps. I'm going to go up under your head, your hair, and just see. Okay. Looking at your hair, it's nice, thick, and well dispersed. So the next thing we're going to do is look at your eyes, and that's also going to include an eye exam. We're going to look at the Snellen chart to kind of look at your eye vision. Okay. So the first thing I want to do is just look at the symmetry of your eyebrows. Do you mind if you take your glasses off so I can? Okay, awesome. Thank you very much. Looking at your eyebrows, looking at your eyes, and I'm also going to test your visual acuity, okay?
Okay.
So one of the first things I like to do with your eyes, I'm going to check them with my eye pin light. And what I'm going to do is just look for the reactions of your pupils, okay?
Okay.
I am going to come with the flashlight, and you just look at me. I'm looking to see how eyes respond. Excellent. And now I'm going to go to the other eye. Excellent. And I'm looking to see how your pupils respond. Look just at me. Great. Great. Now I'm going to have you follow the pen light, okay? I'm going to make an H formation. Great. Now the other eye. Great. Just follow the line. Great. Excellent. Now, look behind me. I want you to focus that way, but I want you to look at my finger, okay? Now look away again. Closer. Great. Thank you very much for that. Now, let's look at the Snellen chart, okay? We're going to have you stand about 20 feet away, and we're going to examine your eyes. For this, you can put your eyeglasses on. Okay, and take your time. Great. Now, I want you to read for me the line that you can see the most clear.
PECFD.
Thank you very much. That noted. Okay, you can have a seat here. Thank you for that. Now, I'm going to use my fingers. They're going to go in opposite directions, and you tell me when you start to see my fingers wiggle. Just say now.
Now. Now.
Excellent. Thank you for that. And you can put your glasses back on if you like. Okay. Now we're gonna move from, we did your head, we did your eyes. Thank you for that. Now we're going to do your ears. Okay. So I'm going to take my otoscope and I'm going to look in each ear canal.
Doctor, I like to tell you that my ears are very sensitive.
Okay. I will make sure that I'm very sensitive with your ears. Okay. And I'm a student nurse practitioner, not a doctor yet. Thank you. So when you're checking for the ears, you're looking at the external ear, looking at, again, the size, looking for any drainage, um, any kind of lesions or any problems with hearing. You don't wear a hearing aid or anything like that?
No.
Okay. So I am going to look into your ears and just pull back. Okay. Good, your eardrum looks clear. Now I'm going to go to the other side and look at your other ear. Again, I'll pull your hair back. One here. Good, nice and clean. Okay. Now I'm also going to test your hearing using a tuning fork. Okay. So to do this, you would just basically activate the tuning fork, and then I'm going to place this. Tell me if you hear that.
No.
Okay. Do it again.
Yes.
Good. Okay. Now I'm going to test it behind both ears. And you should also hear a sound. If you don't hear it, let me know, okay?
Yes, I hear it.
Okay, good. You hear that?
Yes, I do.
Okay, good. And your hearing is good. Thank you for that. Okay, so we did your head, we did your eyes, we did your ears. Now I'm looking at your nose as well. Again, we look, inspect with our eyes, and I am going to, again, use my scope, just clean it, and to look in each nostril to make sure. Oh, before we do that, I want to test your hearing, okay? I'm going to say a word. I'm going to occlude this ear, and I'm going to say a word, and you repeat back the word that you think that you heard me say, okay?
Okay. Apple. I didn't hear it.
Okay.
Silver.
Very good. Okay. Now we're getting ready to inspect your nose, okay?
Mm-hmm.
So for safety symmetry, I am going to look and just tilt your head back a little bit. Okay. Look at the other nostril. Okay, good. Okay. Any problems with your nose or anything like that?
Like I have sinus, and sometimes I have a sinus headache, you know.
Okay, so can you remove your glasses on me? I'm going to. Just feeling your sinus pressure. Okay. Thank you so much. Any problems or? Okay. Okay. Thank you very much. You can put your glasses back on. Okay. So we looked at your head, we looked at your eyes, we looked at your ears and your nose. Last thing on the assessment, I'm going to inspect your throat. Okay. Okay. So can you just say "ah" for me? Okay, ready? And so we're gonna do a couple of things. First thing I want you to say, I'm gonna be looking at your Google, your tonsils, and anything like that. Have you ever had your tonsils removed?
No, but I have always had tonsillitis.
Tonsillitis. Okay. So stick out your tongue for me and say open wide. Okay, good. Now I want you to take your tongue and put it to the roof of your mouth. Flat. Very good. Okay. Looking for you. Okay. And rest your tongue. Let me look at the roof of your mouth. Rest your tongue. Stick it out and just rest it. Okay. Excellent. Now I'm gonna just check your thyroid. So I want you to gently swallow for me, okay? Okay. And swallow. Good. Okay, good. Any pain or discomfort?
No.
Okay. Awesome. Now let me just take a look at your fingers. Because you have on nail polish, wanted to just check your circulation. It's hard to do that when you have a fingernail overlay to be able to check for circulation. This W has her nails painted, so it's hard to check her circulation. In her fingers or anything like that. Okay. Well, Ms. Washington, that ends my assessment for your head, eyes, ears, nose, and throat. Thank you so much for being my volunteer patient.
Thank you very much.
Thank you.